So if somebody's going to get this procedure done, walk me through what it's like when I go into the clinic to get this done. How long does it take? When can I notice a difference? And when can I have my joint back normally, or how long can I expect, I guess?
Well, every joint is different. Every joint heals differently. Every joint has a different pathology, and every person's own psychology is different. So I generally find that happy people seem to heal faster. There are certain categories of people I won't mention who just won't heal. They may have a pain syndrome that's at a 9 out of 10, and we bring that down to a 1, and then in their psychology, that 1 becomes a 9 again. So they're going to complain no matter how good they feel. So there's a lot of different variables involved with this. So I'd have to talk in generalities.
Sure.
You pick the joint and I'll comment.
Well, most popular you said is the knee, so let's stick with that.
Well, let's say a person comes in with a meniscal tear. That's common. I'm going to guess I have 2 meniscal tears. I'm going to guess that you have some meniscal tears, even if we don't have terrible pain in our knee, just because we've been athletes and we've used our knees. What is a meniscal tear? It doesn't have to be much of anything. If it's a large enough flap such that it can get in between the joint and keep you from extending or bending your knee, then it's a problem. Then it should be taken care of surgically, probably. Otherwise, if a person has full range of motion of their knee joint or any other joint, I think prolotherapy is the way to go, or PRP. So what does a person do? They come into the office, I do a history, see what happened, I do an examination, I stretch the knee, see if there's any laxity, see if there's crepitus, which is a grinding, between the bones, which is usually the patella, which is the middle, the kneecap, which can be off track a little bit. All of these things are generally easy to get rid of the pain. How many treatments does it take? It varies on the person. It varies what the degree is. I had one football player that had 12 knee surgeries on his left knee. He's pain-free. He was ready for a knee replacement. I couldn't get a needle into his knee. I had problems doing that. Now, I have a new procedure which is using ultrasound, so I actually see into the knee, so I can place the needle into a different spot than I used to. I used to go into the arthroscopic ports, which was very painful, and the studies show that only maybe 75% of the time would the solution actually get into the joint. The way I do it now under ultrasound guidance, I can watch that needle go into the capsule of the joint and see the solution filling up that capsule. So the technology has really increased in the last few years. My patients are getting much better than they used to because the technology is better. Plus the technology of PRP has come into being, which is platelet-rich plasma, which is the process of drawing blood from a person's arm, taking it into a centrifuge, spinning it down, taking the platelets out, and injecting those instead of dextrose or some other solution. It's a stronger inflammatory response that takes place. There's more growth factors. And we don't have back-to-back studies yet, but I'm sure they're being worked on. And I'm going to guess that PRP is a better procedure overall, although it's more expensive.
Why is that?
We have to buy a kit. Don't have to, but it's safer to use a kit. And that is a very expensive kit to buy. Plus it takes us more time to do it. We have to draw the blood, we have to spin it, we have to do different chemical changes to it, and then put it back in the body. So whereas doing, let's say, knee prolotherapy with dextrose might take me a total, if the patient's not speaking, comes in the office, wants to get out quick, it may take me 3 minutes on the short end. The injection takes a minute. With PRP, it's going to take probably a half hour.
Okay. But with the prolotherapy, let's stick with the knee. They can go in, get it done, and literally walk out in 10 minutes,
That's
right?
the best thing about prolotherapy of any kind, even PRP. Person comes in the office, they take a break from work, they get back in their car, and go back to work. Now, I shouldn't say this because if my patients are listening, they'll get mad at me. But I can do prolotherapy on myself. I can inject myself. And I may go out and do sports the same day because I can do it for free.